All right. Good morning, everyone. A very warm welcome to all of you joining us today for this highly relevant and timely webinar hosted by Homeopathy 360. I'm Dr. Noori, Senior Editor, and the title of today's session is Homeopathy and Female Infertility, a Holistic Approach. Today's session will take us beyond just symptom management. We'll explore how homeopathy can address the root causes of infertility, such as hormonal imbalances, menstrual irregularities, stress, and lifestyle related issues, all through a gentle, individualized, holistic lens. It is my great pleasure to introduce our distinguished speaker for the session, Dr. Poonam Meghani. Ma'am has over 15 years of clinical experience as an independent homeopathic physician and over 9 years of teaching experience as an associate professor at Rajkot Homeopathic Medical College. Ma'am also runs a charity clinic providing affordable care to undeserved communities. She has been recognized for excellence in teaching and is especially well known for her success in managing infertility and various gynecological conditions through classical homeopathy. Please join me in welcoming Dr. Poonam Meghani, ma'am. Ma'am, we are honored to have you with us today.
Thank you.
So while ma'am begins the session, I request the audience, if you have any questions, please put them in the Q&A box and we'll try to take them in the end of the session. Thank you. Ma'am, the digital stage is all yours now.
My screen is visible.
Yes, ma'am, we can see it.
So, today's topic is homeopathy and female infertility.
Ma'am, very sorry to interrupt. Can you please check your audio? Its voice is breaking actually. Yes, ma'am. Maybe you raise the volume and mute, unmute, try once because it is breaking.
Is it clear now?
Now it is fine.
So, if you see through the infertility, it's a we can say it's a lifestyle disorder which was occurring nowadays, and the social pressure is more over towards the couples regarding fertility. So, if we see the fertility in case of female, it contributes around 40 to 50% cases, and the most common cause behind the female infertility is the ovulatory dysfunction. So our introduction that the infertility is a growing health challenge. It's a worldwidely growing challenge that fertility is reducing nowadays. And the reason behind this is not only the physical fitness, but it also leads us mental, emotional, and even the social lifestyle also disturbing with this new growing challenge. Our aim is here to explore the causes investigation, the modern medicines, and specifically more concentration of our is on homeopathic management. So, what is infertility? Infertility is actually an ability to conceive even after a regular sexual intercourse, which is unprotected. And the WHO is telling that even after 12 months of regular sexual intercourse, couple is unable to conceive. But more or less, it is nowadays the scenario is increasing. The couple is trying more than 12 months, more than 2 3 years, and then also the fertility case is reducing. Now, if you go through the infertility types, they are mainly basically two types: the primary infertility and secondary infertility. The primary infertility, that means a couple is trying, and since from beginning, the female is unable to conceive. And secondary infertility, that means a female is having one or two child, and after that, if she is not able to conceive. There are also third variety, that was the unexplained infertility. In that case, there is no identifiable cause. Despite of all the normal tests, all the physical examination is normal, but since then also the couple is not unable to conceive. If we are going to the globally, that statistic is telling that the ratio is increasing day by day. In a around the world, out of six out of one couple is infertile, and amongst these, the male factor is also responsible. 30 to 40% male factor is responsible behind this fertility. Then 50 to 40% both the partners are responsible. The case is increasing day by day. Around 10 out of one couple is infertile nowadays. And even the ratio is increasing more and more day by day because of this lifestyle and the unhygienic food. And these are the reason behind this. Now, why infertility case is increasing nowadays? Previously, the infertility rate is not that much high, which is right now there because of lifestyle and stress, right? The lifestyle is in difficult and difficult day by day. The stress factor is increasing day by day. Even the food quality is not that much. Nowadays, youngsters are moving towards the junk food, and because of that, they are not getting proper nutrition, and because of this malnutrition, they are either getting underweight or because of this junk food and this all fatty food, they are getting obese. And because of this obesity, the nutrition level is disturbed, and because of these, the hormones definitely get up and down. Environment is also not healthy nowadays. The toxins are increasing in environment, and the global factor is also affecting. And because of all these things, the hormone cycle of female getting disturbed. And also infections, some kind of infections. Right now, the pelvic infection and STD cases are increasing day by day. Though we are in a new generation, but the cases are increasing nowadays. Now, who are all having the risk factor of infertility? Specifically in the female, uh, after the age of 35, the fertility rate is very slow or very down. Then in case of male, the fertility rate is also lower, though the social are more or less telling that the male are not that much reducing their fertility. But they are also definitely getting reduced in their fertility rate after the age of 40. So if the couple is planning their first pregnancy just after the age of 35, then definitely they will face the primary infertility problems. So nowadays, as I said previously, the weight issue is more because of hormone, because of junk food, and because of this lifestyle, because of sedentary lifestyle, sedentary work habits, they are getting obese, and because of these, they will face infertility in the future. If we go towards the lifestyle factor, specifically the some habits, some food habits, some smoking and alcohol, that also reducing the fertility rates. If the person has previously radiation or the chemotherapy or they are under some treatments that also affect their fertility. Environment cause, if we see right now, the direct exposure is there. Right now, the walking habit of a people is on laptop, on mobile. They are out of 24 hours, they are on laptop or on screen on 10 to 12 hours. So that definitely affect their environment and affecting their hormones. There is occupational hazard. Right now, the previous lifestyle, it was not that much stressful. The people are not taking that much stress, but right now, because of comparative lifestyle. If some people are doing that, then people say that I have to do that. So occupational stress is more, the competitive life is more, and because of that, people is unable to balance their work life and their house life. So and even their sexual life. So that is affecting the fertility at most. Now, what are the basic causes of female infertility? If we say, generally people have the issues that in what is fertility? That means ovum and sperm is meeting and they fertilize and forming the cycle. So, basically, the ovum, the main cell of the female reproductive cell, which is responsible for the uh, reproduction, that is over, right? So the ovulation disorder, if the ovulation is not on time, that is definitely affecting a female through its menstrual cycle. If menstrual cycle is not regular, it is not regular, it is not coming on time, or it is delayed, or it is having a more flow, that definitely shows indirectly effect of ovulation of that female. Right now, the cases of PCOS, polycystic ovarian syndrome, that is increasing nowadays because of under the effect of hormone, the woman not getting mature on time, and if it not get mature on time, that is not released on time, and if it is not released on time, the chances of getting pregnant is very, very low. Then another thing that was a hormonal disorder, specifically thyroid disorder. That thyroid disorder is not directly affecting the fertility, but it is indirectly affecting the hormonal cycle of a female during the reproduction, and indirectly it is affecting ovulation and ovulation. Because of there is not ovulation on time, the fertility problem is increasing. Prolactin issue is also increasing nowadays, and that is affecting the LH-FSH ratio, and that is also affecting estrogen and progesterone cycle during the ovulation. Then another main cause of the fertility, that was fallopian tube. If fallopian tube is blocked, that is the main the transformer of the or ova from the ovary to the uterus. So if fallopian tube is blocked, then there are no chances to fertilize the ova with the sperm. Right. So what is the reason behind the fallopian tube blockage? Fallopian tube may get blocked during the time of infection, specifically pelvic infection. And if that pelvic infection is recurrent, it may lead to the salpingitis or pruritus, and that leads to a blockage of the tube. Next, come to the uterine causes, specifically the inner layer of uterus, that is endometrium. If the endometrium layer is blockaged by any causes of the disease, for example, fibroid. If fibroid is there, specifically endometrial variety of fibroid, that is affecting the inner layer of the uterus, and if in case fertilization happens, then also implantation cannot be happening on the proper side of uterus, and that leads to unable to conceive. Then endometriosis, specifically tube, fallopian tube, and ovary, they are the commonest site of endometriosis, and that also affecting the hormone level, and that also hinders the implantation in the uterus. Nowadays, the cases of premature ovaries are increasing, and increasing. They are just because of loss of ovarian function. Nowadays, even in younger age, at the age of one of my cases, at the age of 20 years of female, and she is having low, she's not having periods during the regular periods without any medicine. Then we go for the test, and we got the stick ovary. Right. So what is stick ovary? Stick ovary is the ovarian function is reduced. Ovary is going under the fibroid condition. The amount of the ova is reducing, and even it shows the low AMH level. So that case is also increasing nowadays. Stress and lifestyle factor, obviously it affecting the fertility. So specifically behavior influence, the stressful lifestyle, the so many blood pressure, even the surrounding social environment that also affects fertility loss. Now, what are the symptoms? Actually, the infertility doesn't have any symptoms. That just comes with you with a problem that we are not able to conceive. That is the symptom, right? So actually, it's not a symptom, but it's a vast number of symptoms. So if you go through the menstrual history and detail of the history, then you will definitely find the irregular or absent period in that case. Or even if we take the menstrual history, the puberty might be delay or at the time of puberty she might have any complaints. Specifically, in some cases, pelvic pain is there, dysmenorrhea is also there, and that is just because of any underlying cause which is lying in the uterus or the tube or the ovary. Hormonal changes. That is majoritarily seen nowadays, like in younger age specifically, hair growth is there, acne is there, overweight is there, and specifically that leads us a physical picture of a PCOS. And if you go through the test, you'll definitely get the PCOS in their sonogram. And repeated miscarriage. So if in repeated miscarriage 1 to 3 times they have a conceived, they get positive test, but pregnancy is not continue more than 1 2 months. So that is also a case of primary infertility, and that is just because of hormonal imbalance. When the progesterone level is very low, the female is getting repeated miscarriage. Now, the ovulation and infertility. Usually, nowadays people are very educated, very well to do. They are work pressure and everything. But sometimes there is just a physical cause behind the fertility. And what's that physical cause? They don't know when the ovulation happens. Nowadays, lots of things are come. Ovulation kit is available. If the people is aware, they are taking the ovulation kit and they check when the ovulation cycle is there, when ovulation happens. So if we follow that time, if we follow that time period, and in that case, if sexual intercourse happens, there are definitely chances the female get pregnant. Usually the fertile window is around 10 to 18 days if the cycle is of 28 to 30 days and which is of a regular flow and on time. So that female may get fertile during the 10 to 18 day of that cycle. Now come to the hormonal balance and infertility. Usually we have already talked about the hormonal imbalance, but what is that hormonal imbalance? Usually during the menstrual cycle, the first half of the menstrual cycle, FSH is coming from the pituitary gland and that stimulates the follicle in the ovary, right? So ovarian follicle got influence under the FSH, follicle stimulating hormone, and they just got flare. So out of that, one secondary oocyte is releasing, and that comes and pick up by the ovarian fimbria of the tube, and that comes to the fallopian tube, and then the fertilization happens. But if LHA, FSH, and LH imbalance is there, so the time of ovulation may be hindered because of this. If FSH is not coming on time, then there will be no stimulation on time. So in that case, that cycle is longer and longer rather compared to the 28 to 30 days cycle. After FSH is coming on time and LH is not coming on time. But not that much of a crisis. So that is one of the shorter or there is
Um, Ma'am, sorry to interrupt, but there is some audio issue. We cannot hear you. It's. Can you please try again, ma'am? No, no, we cannot hear. Can you unmute, mute? No, ma'am. Maybe it is a signal issue. No, ma'am. Ma'am, maybe you log out and log in again. That will help. Audience, please be patient. The speaker is trying to log out and log in again. Till the time, if you have any questions, please put them in the Q&A box. We'll try to take them in the end of the session. And stay connected with Homeopathy 360. Thank you for your patience. Yes, ma'am is back again. Thank you, audience.
Now,
Yes, we can hear.
so
Perfect.
balance. Discuss the effects of gender imbalance, the thyroid disorders that affecting the pituitary hormone and that affecting also the ovulation factor, and that is leads to infertility. Whenever there is high prolactin level, that will not be an ovulation because of the prolactin higher, and that hinders the maturation of the ova, and there will not be ovulation, and that will lead to infertility. Whenever there is a low testosterone level, specifically in the male, along with the female, males are also responsible with the hormonal imbalance level in case of infertility. So, in case of male, if the testosterone level is low, in that case, the quality of the sperm, the development of sperm is poor, and we may face azoospermia or oligospermia in that case, and that is definitely affecting or hinders the implantation. Now, what are the main investigation function? How we come to know that female is infertile? Right? So, how it is not able to getting pregnant. So, if you go through the hormonal profile, these are the basic hormones which we need to go through for investigating a case of infertility. In case of female, specifically FSH, follicle stimulating hormone, LH, AMH, the thyroid level, T3P40ASH, and prolactin level. These are basic and key hormone which we need to rule out during the investigation of the case. Then, if we go through the male part, in case of male, we have to also rule out the prolactin level. We also rule out the testosterone level. And in case of male, we have to go for total sperm count, and then we come to the case of fertility. Then, for the ultrasonographic view, we have to observe a specific ovarian function and ovarian reserve also we can see through MH also and through the ovarian sonography also. If the female is having PCOS, we definitely get the picture of a multiple small follicles seen in the ovary. In case of fibroid, we have to rule out which variety of fibroid is there, which is hindering the fertile ratio of that female. So, if it is of endometrial endometrium variety of the fibroid, that is definitely affecting the fertility of the female. And if it is hindering the uterine cavity, if the fibroid is there specifically in the uterine cavity, we just need to remove that fibroid and we may come to the case of pregnancy. Then HSG, hysterosalpingography, it was one of the definitely tests to rule out the cavity clearance of the uterus as well as the fallopian tube. We come to know that if the fallopian tube is patent is there or not. If it is blocked, then we have to rule out that through surgery or through any medication. Then ovulation monitoring. Ovulation monitoring, we can come to the normal red menstrual cycle. If the female cycle is regular, then we come to know that the ovulation may happen on 14 or 15 day of that cycle. We can check through the ovulation kit, which is available nowadays, or we can go for a serial ovulatory sonography. In that case, 3 to 4 sonography, serial sonography is done. And at the end, we got a report that on which day ovulation is happening and which size of ova is there. Laparoscopic, that is also helpful to investigate a case, specifically in case of pelvic hedation. Whenever there is a case of sarcophagus, pelvic hedation is that oozing off from the tube is there because of infection or inflammation, and we come to know through the laparoscopy. Then hysteroscopy, specifically uterine abnormality, some varieties of polyp or some varieties of fibroid, we have to go for hysteroscopy to examine the inner side of the uterus. Now, this is a very hindering factor, that was the emotional and the psychological impact. First of all, if the couple is not getting conceived on time, social pressure is so much. So, here and now, the relatives are taking, when will we give you the good news? When will we give you the good news? That social stigma is more affecting on the stress, and that affecting their sexual life, and there will be a marital conflict between the couple. Already they are on the anxiety and depression, and if the case is longer, they go frustration on their life. So specifically, emotional impact is affecting the hormonal level, and hormonal affecting the fertility rate. Now, there are some common myths in the society regarding infertility. That first one was the only women are responsible for the infertility. It is not at all right. Only 40 to 50% case of the fertility, female is responsible. There are so many causes behind that. We had already seen the causes. So, not only the female, also the male, and even in some case, both partners are responsible behind this fertility. Now, the myth is infertility, that means complete sterility. It is not complete sterility. The couple may can conceive with proper management of the treatment, and because of that, they can conceive. Another myth is that was stress alone causes infertility. That is not only true. Stress is the factor that hinders the fertility, but there are so many physiological, even biological causes also there. The structure of ova is not good, some structure of sperm is not good, so stress is not the thing. Also, so many factors, emotional, psychological, so many factors are there which is creating infertility. There was one myth that conception is only possible through IVF. If one or two treatment fails, then the couple is directly going for the IVF, right? But IVF is not only treatment. It was good treatment, but it is not only treatment for the infertility. Then delaying marriage doesn't affect fertility. Nowadays, younger generation is planning their career first, and then they go for marriage. So, and they have an idea from the social media, and so that delaying marriage doesn't affect the fertility. But delaying marriage is affecting fertility, and that is for sure. Modern medical treatments, as well as the homeopathic holistic approach towards the infertility. But the comprehensive treatment, specifically contemporary medicine is there. So they have their own limitation. But in case of homeopathy, it also affects their lifestyle, their fertility challenges that affecting that general health and the reproductive health. So there are so many things behind the treatment of fertility. We'll go through one by one. First of all, this is the modern medical treatments, right, which is available we have in our social thing that they first go for the modern medicine because uh, routine medicine are coming first during the emergency. Right? So they will go for the and the modern medicine have the first and foremost treatment, that is ovulation induction. So how will they induct the ovulation? They'll just give you the clomiphene citrate 250 milligram for 3 to 5 days, and they will just handling the ovulation improve person, and then they go for the mature ova. So in that case also, there are chances more than one ova may get mature at a time, and there are chances the to get pregnant. Letrozole is also one of the good medicine for the ovulation induction. Then hormonal therapy. So the targeted hormone, during the investigation, if we come to know that FSH is low, the prolactin is higher. So if we target that hormone, we target that specific level of that hormone, and the hormone which is lacking should be given through injection or through the tablet. And there is, we have discussed the cause behind the uterus and the fallopian tube, that if tube is blocked, then blocked tube should be removed, or the blockage should be clear, or in case of fibroid, the fibroid should be removed surgically. And then we definitely consider for that couple. Then assisted reproductive technique, that also helpful if couple is unable through the normal physical relationship. The assisted reproductive techniques are there, and which is very powerful, known to be in this time of modern medicine. First one is the IUI, intrauterine insemination. If there is cervical barrier is there, it's which is hindering the sperm quality, or that affecting the sperm structure. In that case, IUI is very helpful. In vitro fertilization, where the ova and the sperm of that male and female are taken, matured ova and mature sperm is taken, and in case of petrified dish, it should be fertilized. ICS SI, that is intracytoplasmic sperm injection, that if the factor is regarding the outer layer of the ova, then sperm is directly injected inside the ovum, and then fertilization can happen. Now, we have discussed these methods, but they are not that much easy. They are very expensive. There will be a higher burden financially towards the couple, and if couple want to have that kind of treatment, then also they cannot afford this kind of treatment. Then stressful and invasive. It's not easy to do this kind of treatment. They are very expensive, especially economically, and physically it is demanding. They need a more time during the all the kind of treatment. Side effects of this hormone, the hormonal side effect is very dangerous. They are affecting the normal cycle of the pituitary and the ovarian axis. They are disturbing the hormones, and definitely they will having the adverse effects. There might be a weight gain, there might be other symptom is reactivating some kind of hormonal side effect. It is not always successful. These are the humors. They are good, but they are not successful, and that was the worst effect on the mind of the patient. Now, what are the role of lifestyle in fertility? Fertility is the our main goal in today's seminar is to improve the fertility. So, lifestyle is definitely helpful to improve the fertility, specifically healthy diet, good amount of protein, carbohydrates, and some amount of fat is required during the balancing diet, and that will improve the nutrition level of the patient, and that will definitely improve the hormonal cycle of the reproductive health. Then regular exercise, the maintaining optimal physical condition, right? That is, for example, if the couple is doing regular exercise, their hormonal level will definitely get regular within a time, and that is helpful in the fertility. Now, proper sleep. Because of proper sleep, essential hormones are releasing on time to time, and that are our main thing for the infertility case. Next is stress management. Now, stress management is very important for the improving the case of fertility, specifically the psychological barrier which is hindering their mind or psychological effect and which is affecting our conception. So we have to rule out what was the lacking around that psychological effect. Then avoid toxins, alcohol, smoking. If habit is there, we have to reduce that because they are eliminating harmful substances which affects the hormonal cycle, and that also reducing the quality of the sperm and ova, and that affects the fertility. Now, where comes the end of the allopathy? The beginning of homeopathy is there. So it will work on the root cause that is affecting specifically, not on a symptom of a patient, or patient have no symptom. Patient has just only symptom, that is she's not able to conceive. Right? So if we go through the proper physical history, proper psychological history, and proper gynecological history, we can work on that cycle. We can improve their reproductive health, and we can help that patient to conceive on time. Now, with the help of homeopathy, there is not just only working on the reproductive health, it also improves the general health, it also improves whole well-being, and that affects the person. Balancing the hormones with homeopathy, that homeopathy is working on a root cause, and that starts the hormone levels on its own. Hormonal cycle uh, is improving, and that gives a restoration. Previously, the menstrual cycle was normal. Previously, that cycle history is good. But nowadays, the couple is having a disturbance in the cycle. So, if that kind of cause is there, homeopathy will slowly and smoothly work on the cycle. Addressing the emotional stress, that is holistic, specifically including the psychological well-being. If person is, we have a in homeopathy that if person is not feeling well, that is the person is diseased. In this case, person is completely physically normal, but person is not able to conceive. So that's why person is diseased, and here our disease is fertility. So we can definitely work on that with the holistic approach. There are some homeopathic medicine which are miraculously working on the female in the cases of female infertility. Sepia, which is one of the good female remedy. It's work on the irregularities of the menses, that some kind of uterine weakness, aversion to sex, and the blotches are there. So that is one of the good medicine. Pulsatilla, Pulsatilla is younger generation right now. Cases are more increasing with the younger generation. That is also 25 to 30 years of age. Even the cycle is normal, then she is not able to conceive. They have a emotional disturbance. Pulsatilla is very high sensitive temperament, then relate puberty, relate periods, and they want always supports for someone to take the responsibility. Take card is also good medicine for heavy and obese persons who have a bleeding disorder frequently, either irregular menses or delayed menses. And it is also one of the good medicine for easy conception. There are so three medicines which are good medicine that uh, that makes the conception easy. Latex is also one of the good medicine where the condition is main keywords. The patient is having heavy flow or either painful menses, or they are having disturbance in the cycle along with the hormonal imbalance. Naxomica is also one of the good medicine that the female is having infection in nature, digestive disturbance is there, constipation is there, and along with that, menstrual irregularity is there. The person is having irritable temperament, night watching, stressful factor, that is all the picture of Naxomica. Now, next one is lycopodium. So lycopodium is one of the good medicine where along with the GI disturbances, there is infertility cases there, and main cause behind the lycopodium infertility is uterine cause. Uterus having a disturb either endometriosis or fibroid case, lycopodium works well. Next one is Agnes castris. The female is having low sexual desire, menstrual irregularities there, infertility, and there is a hormonal balance issue along with the PCOS development. Agnes castris works well. Netromune, that was emotional disturbance medicine, psychological factor is more affecting in this case. Menstrual disorder is there, and stressful is one of the factors behind the key feature of netromune fertility. Then phosphoric acid, that is also one of the good medicine where exhaustion, weakness, and that is just because of extreme menstruation. Menorrhagia is there, and because of that, that affecting the fertility, that affecting the ovulatory cycle, and there is emotional trauma is the main thing behind the minor phosphoric acid. Aromat, that was the wonderful medicine with the woman having a deep despair, they're having deep trauma on their mind, they have a social stress, full life, and suicidal tendency. Then fertility is also because of this emotional imbalance, emotional distress that affecting the hormonal cycle and that affecting it. In this case, the menstrual cycle is not that much disturbed, but the because of the social effect, the hormonal cycle is disturbed and patient is not able to conceive. Cocculus, that is good medicine along with the digestive disturbance, there is nausea, vomiting, and fertility related with the digestive disturbance. That is one of the critical factors. Then Apis mellifica is good medicine for the infertility along with the ovarian pulse and tubal pulse. Basically, ovaritis is there and that is working on a right side medicine. It is definitely right-sided ovarian tumor, right-sided ovarian uh, ovaritis, and there is specific key point pain is there in case of Apis. That is also good medicine along with the metritis and ovarian tumors. Now, we have see-through, and there are lots of medicine also, and these are the names of the medicine. Definitely, it is working on a specific case taking. We have to choose a specific medicine for specific patient from the case taking, and then we'll prescribe that. So, how will you approach the patient through the case taking? We have to take a full case history, though it take time, but we have to take that kind of history. Full history is required along with the medical history, their menstrual history, when it begins, how was the flow during the beginning, pubertal history that we need to take, and what was the nutritional level at that time. We have to take that also. Sexual infection, specifically in past, if it happens 2-3 months before, we need to be aware regarding the last cases of salpingitis or PID. We need to rule out that goes behind that. Then, if the work pressure or the stress level is higher, if the definitely the infertility case, the person is having stress always. But how much stress level is there? It is affecting their routine lifestyle or it is affecting their work lifestyle. We need to rule out that. Specifically, family history. For these also, we have to rule out the menstrual history. If the mother is having menstrual problem at the time of their age, definitely the daughter is having same kind of features. In case of PCOS, definitely family history is working on that. Diabetic or any kind of hormonal imbalance that we need to rule out and we can individualize that patient for the selection of medicine. And after detailing the case taking, we need to form a totality. Which symptom is more important, which symptom is having a higher degree, and we can choose the medicine accordingly. Supportive therapy along with the homeopathy. Right? Sometimes not only homeopathy works, but Along with the homeopathic medicine, we need to give so many instruction, food instruction, specifically lifestyle instruction, or detox remedies if needed, if detoxification is needed, specifically in the GI disorder. Right? So we need to give that kind of instruction also. And the first and foremost thing is counseling. If the couple is having infertility, we need to counsel both the person at the same time. Because if we counsel one, then there will be no meaning. We have to counsel the couple. We have to explain the rate of fertility, explain the dates of fertility. Then this time is exactly good working for ovulation, and this time, and in that case, if physical relationship doesn't happen on that duration, the couple may not get pregnant. Right? So we need to rule out, along with the homeopathy, we need supporting system and diet counseling. Specifically, we need a more calcium and vitamin C rich diet, so that will helpful in the case of fertilization. Now, what is the role of counseling in fertility? Infertility is one of the things that if we give medicine, its hormone work is there, but if we doesn't counsel a female properly, that emotional burden is as it is, the stress level is as it is. If we are not reducing that with the counseling, our medicine will not work. So, first and foremost thing, we need to reduce the anxiety of the person, we need to reduce the stress of that person with the counseling, and that will reduce the emotional burden, and our medicine definitely work on that. Then improves the partner communication. Sometimes female doesn't know the proper timing. If the communication is not there, if the relationship is not there, that is the physical push behind the infertility. Sometimes there is no need of medicine, just counseling can help us to improve the case of infertility. Sometimes the couple doesn't know the proper technique of the sexual relationship. At that time also we have to counsel that couple, and we can lead them towards the fertility. Then if we are going through the treatment, we have to explain the role of the treatment along with the medicine. The prevention is also needed. So we have to counsel that couple accordingly. We can also, in younger generation, we can also give advice to plan their marriage earlier, so they can have their reproductive life in the beginning. And in that case, if they conceive on time, they may have a healthy baby. Otherwise, if the age difference is there after 35 or 40 years of age, if they are planning, there are chances that they conceive with the help of treatment, but they may get a disturbed baby, either a mental disturbed baby or a unhealthy baby. So, if they want a healthy pregnancy, they have to plan earlier during that. 25 to 30 is the good age to plan for a first pregnancy. Healthy weight maintenance specifically. Usually the stress is really just after the marriage. So they are not working on diet, they are not working on their lifestyle. So they are getting obese. So that maintenance should be required to keep the person healthy. And if the person is healthy, their hormones are on balance, their cells are on a balance, ova and sperm are also healthy, and they may get pregnant on time. Timely treatment of infection. If the female is having just normal vaginitis or a leukorrhea, if it is not treated on time, it may the infection may get upwards, and we might get infection in tubes. I think that is there because of PID. Now, the holistic viewpoint and some takeaways. Like infertility is not physical. It is emotional, mental, physical, and all the things are joining together and forming a fertility balance. If one of the uh, three parameter is disturbed, fertility is going to disturb. So, how homeopathy helps? Homeopathy medicine along with the lifestyle that gives us a sustainable solution, that gives us to treat the case of infertility. So infertility is nowadays rising. Why? It is just because of lifestyle health issue, and that is not only with the female. That is also both partners are equally responsible, male and female, and that is contributing the cases of infertility. Here, investigations are essential, though in your first visit, only female come to your clinic for the case of infertility. But at the same time, you need to rule out the both the partner at the same time. You have to guide both the partner at the same time, counsel both the partner at the same time. Then and then you will get a good result with the help of homeopathy. Homeopathy is very safe and holistic approach that is just affecting their normal cycle, that is just improving their normal hormonal cycle, and that will help us to get a normal pregnancy. My final message is that infertility is not the end of the story, but it's the beginning of the journey towards the healing, towards the hope, and towards the holistic approach of our treating our case of infertility. Thank you.
Thank you so much, ma'am, for that very eye-opening and deeply compassionate session. You have really demystified a lot of concepts and the struggles related to infertility.
Is there any question?
Ma'am, I want to ask, with your years of experience as a teacher, do you think the work done by Homeopathy 360, where we try to connect wonderful teachers like you with a bigger circle of students, across the Indian states as well as internationally, do you think, what is your experience in this regard?
My experience is very good. This is very nice platform. Along with the students, teachers also may get learning through this platform. And I would like to thank Homeopathy 360 that they give me a chance to work on this platform. I'm very pleasant for it.
Thank you, ma'am. Thank you so much for your time. It was a wonderful session. Thank you, audience. Please stay connected with Homeopathy 360 for all the updates, for all the news, more such learnings, more such webinars. We have wonderful teachers with us. And on 14th of October, we have a quiz. So the registration is available on Homeopathy 360. Do register yourself. And thank you, everyone, for this wonderful morning. Thank you once again, ma'am.
Thank you.
Thank you.